My name is Tessa Kenigsnecht, and I'm an undergraduate nursing student at Michigan State University. For the past 7 months, I've been working on a study investigating the lasting symptoms of COVID-19. With hundreds of millions of documented cases since January of 2020 and a wide variety of reported symptoms post-infection, research is necessary to better understand the lasting physiological consequences of COVID-19. The data we collected prompted a question. How does being infected with COVID-19 in relation to COVID vaccination status affect mental health in the months following infection? This is an ongoing descriptive study collecting data from 76 randomly sampled patients who tested positive for COVID, 73.7% of which reported being fully vaccinated against COVID-19. Phone interviews using numeric rating scales assessed mental health symptoms, including fatigue, anxiety, and depression, as well as vaccination status. Among all sampled, 33.3 or 1% or 1/3 reported one or more negative mental health symptoms in the past week attributed to their COVID infection, as seen in this chart here. 26.3% reported fatigue, 15.8% reported anxiety, and 14.5% reported depression. Reported ratings on a scale of 1 to 9, with 9 being the worst, for fatigue and depression were descriptively higher in unvaccinated participants, as seen in this chart pictured. Unvaccinated participants rated their fatigue in the past week a 6.8 out of 9 versus a 5.9 for their vaccinated counterparts. And unvaccinated participants rated their depression in the past week a 7.0 out of 9 versus a 6.1 out of 9 for vaccinated participants. Those unvaccinated also rated worse interference of daily activities in the past week on a scale of 0 to 9, 9 being the worst, by fatigue and anxiety than vaccinated participants, as seen in this chart. Unvaccinated participants rated their interference by fatigue a 5.2 out of 9 versus a 4.7 out of 9 for vaccinated counterparts. Those unvaccinated also rated interference by anxiety a 4 out of 9 versus a 3.8 out of 9 for vaccinated participants. This data reports worse feelings for fatigue and depression and additional worse interference of daily activities by fatigue and anxiety in unvaccinated participants who contracted COVID-19. This suggests that contracting COVID while unvaccinated may be associated with worse post-infection mental health. Additionally, the prevalence of all sampled who reported symptoms of mental health, 33.3%, suggests that COVID-19 may negatively affect mental health. These findings warrant further investigation to better understand the lasting symptoms of COVID-19. Thank you for your interest in our research, and thank you to my mentor, Dr. Rowe.